We've all been there, right? Nipped by a playful puppy, scratched by a grumpy cat, or maybe even had a surprisingly aggressive run-in with a squirrel. But here is a fascinating fact that actually surprises a lot of people. Not every single bite requires antibiotics, and not every bite requires a vaccine. So in this explainer, we are going to walk through a clear, structured medical triage process. We'll explore the exact decision tree that helps professionals figure out what treatment is actually necessary and what can safely be left alone. Let's get right into it. Okay, let's dive into this. To figure out if you really need medical help, the entire triage process starts with one simple fundamental question. Has the skin actually been broken? I know, it sounds incredibly basic, but this is absolutely the golden rule of bite assessment. This one single question serves as the primary fork in the road for deciding every single step of what we do next. So if the skin is intact, meaning it hasn't been broken at all, you can generally breathe a massive sigh of relief. Even if a large dog's tooth aggressively dragged against your arm, if the skin didn't actually break, well, antibiotics generally aren't needed at all. However, if the skin has been broken, we immediately escalate our assessment. We are no longer just looking at the surface anymore. Now we have to evaluate the depth of the wound, whether it's drawn blood, if there is crushed tissue, or if it's been contaminated with dirt or, perhaps even a tooth fragment. A break in the skin triggers these critical diagnostic steps simply because the risk of infection shoots up significantly from this exact point forward.
So the crucial point is that not all broken skin is treated equally. The context of the bite matters immensely here. Certain anatomical locations are considered extremely high risk. We're talking bites to the hands, feet, face, genitals, or directly over a joint. These carry a much higher risk of complications and are far more likely to require antibiotics. Why? Because these areas often have less blood flow, or they can trap aggressive bacteria deep down near the bone and joints where it's just much trickier to heal. But it's not just about where the bite is located, it's also about who was bitten. Underlying patient health conditions, often called comorbidities, play a massive role in this triage process. If a patient has diabetes, a weakened immune system, or say they have no spleen, their body's natural ability to fight off potential pathogens is really compromised, and that severely escalates the overall risk profile of that specific bite.
But what happens if the bite has already progressed past that initial stage? If a wound is becoming increasingly painful, red, swollen, or it's starting to discharge fluid, we are looking at an active infection. I really want to emphasize a very important distinction here. If a bite already shows these classic, undeniable signs of infection, antibiotics are no longer just something to be considered. The debate is entirely over. At this stage, antibiotics absolutely must be started straight away to get that infection under control. And this brilliantly illustrates how we categorize different types of bites: human, cat, and dog or other pets, against the specific need for antibiotics. I actually want to invite you to pause the explainer right here for a quick second and take a screenshot of this critical decision tree. It is an incredibly handy matrix to just keep on your phone. Notice how human bites that break the skin and draw blood, or are located in those high-risk sites even without blood, lean heavily towards needing antibiotics. Then you have cats. Cats are infamous for deep puncture wounds that act like little bacteria needles, literally injecting pathogens deep into the tissue. That's exactly why they warrant careful consideration if the skin is broken. For dogs, a superficial break in the skin might not need antibiotics, but a deep puncture, a crush wound, or visible contamination, that changes the game entirely and bumps it right up into the recommended category. Let's move to the next level of triage and see how this builds. Because beyond the immediate risk of a localized infection, a break in the skin opens the door to two overarching systemic threats we always have to check for: tetanus and rabies. For tetanus, the risk triggers are incomplete primary vaccinations, boosters not being up to date, and heavy wound contamination. This is especially true if you are bitten outdoors in a garden or maybe a farm setting, because tetanus bacteria naturally live in soil and manure. Rabies, on the other hand, is driven largely by geography. While it is not routinely a concern for a bite from a pet based in the UK, any bite from a mammal in a country where rabies is known to occur triggers a major red flag, regardless of how trivial the wound might actually look. Now, what's really interesting about this is how translating those systemic risks into specific protocols reveals some pretty critical timelines. We see clear criteria for who needs a tetanus booster, basically anyone with an incomplete course or an out-of-date booster where the skin breaks. Add severe contamination from that garden soil or manure to the mix, and tetanus immunoglobulin comes into play. But look closely at rabies PEP, that's post-exposure prophylaxis. This is an absolutely urgent, time-critical risk assessment.
If you are in a country where rabies occurs, you need this assessment immediately. The clock is ticking and it simply cannot wait. And finally, please don't overlook human bites, which uniquely require a case-by-case risk assessment for bloodborne viruses like HIV, hepatitis B, and hepatitis C based entirely on the specific exposure risk. As we wrap up this explainer, I want to leave you with a comforting but firm thought, perfectly captured by this quote. Getting it wrong isn't worth the risk. Look, I know it can be incredibly tempting to look at a minor scratch from a dog or a tiny puncture from a cat and just brush it off as nothing. We've all done it. But the absolute bottom line is this. If you are ever unsure about whether you need antibiotics or a vaccine, getting a professional assessment takes just a few minutes of your time. Guessing simply isn't worth the risk to your health. So the next time you or someone you know gets bitten, will you know exactly what questions to ask to keep yourself safe? Thank you so much for joining me for this explainer, and please stay safe out there.